Hello, my name is Jeff Cross, and this is Straight Talk, and I'm pleased to introduce today a familiar face, Dr. Gavin Macgregor-Skinner, the Director of GBAC, a division of ISSA. Hello, Gavin.
Hi, Jeff. How are you?
I'm good. Thank you for visiting us with us today again. What we're going to talk about today is a little history. Today is what, February 17th? It's been about a year ago when you did your first on-camera interview with Hong Kong TV. In fact, I think it was February 14th you mentioned earlier. What was that like? And as you were talking to the folks on camera back then, did you see this coming?
It's a really interesting question as I start to reflect on what's happened in 12 months, Jeff. On that interview, February 14th, 2020, it was a new virus, a new coronavirus. A lot of unknowns, but we also had a lot of knowns because we had dealt with coronaviruses before. We have coronaviruses in the normal flu season. We've had coronaviruses back in the SARS-CoV-1 outbreak in 2003, the MERS outbreak in 2004. So we knew quite a bit about these viruses. What was interesting was that what was validated, what we actually learned by being that the 18 days I had in Hong Kong and seeing patients and working with journalists and other people and learning about this virus really said, something's going to happen here. Did I know it was going to go where it is today? No, not at all. Am I surprised as an epidemiologist? Yes, I am. But I knew that we had the tools in the toolbox to beat this virus.
So thinking of Hong Kong in that interview, they were testing apartments back then, about a year ago, swabbing, discovering things, weren't they?
Yeah, Hong Kong had been through a similar coronavirus outbreak, SARS back in 2003. They knew from their 2003 experience that the coronavirus survived on surfaces, not for hours, but for days. They had to go in and test very quickly and rapidly this new coronavirus, which we now know as SARS-CoV-2. And what was really interesting, while I was in Hong Kong, they released publicly those results, Jeff, that this virus didn't survive just for hours. It survived for days in those apartments on so many objects, on so many surfaces, on so many different materials. So we knew even right from the very start, this was going to be a huge challenge for the cleaning industry.
Yeah, the warning bells were going off, but a lot of people didn't really pay much attention until we saw the pandemic announced. Tell us this, Gavin. Let's talk about the evolution or concept of cleaning workers during this past year. They're essential workers. They're on the front line. Are they viewed as such by others?
Oh, I think all of us at ISSA, and especially within the GBAC team, the Global Risk Advisory Council, and you've heard me say this many times, Jeff, I would like to see formally accepted and acknowledged that janitorial staff, cleaning companies, cleaning people throughout the US should be considered as part of the US critical infrastructure. They play a role that society depends on, but they also should be considered as essential workers. And we've seen this with the vaccines. As the vaccines has run out, and we've seen these plans come at the state level, they've given a list of here are the people they consider as essential, and they're going to get the vaccine first. Janitorial and cleaning staff aren't on those lists, and it just so upsets me so much that why aren't they there? And we really have to be better advocates. We really have to say these people work so hard in hostile environments where there is unknown infectious disease agents. They need to be considered as part of the US critical infrastructure, and you need to be considered individually as essential employees.
Yeah, I agree. And maybe that'll happen one day. And we know that our workers are important to the entire process of public health. Gavin, looking at the entire year, going back a full year to your first interview about this, what are your key observations and concerns? What's your vision?
Oh, Jeff, again, we can see this from, adults learn by doing. And I can see from the cleaning companies that I work with, those that are doing really well at the moment are focusing on their staff, training them with the techniques, the new tools, the equipment that are out there, but training them on the disinfectants and the cleaning products that we have and how to use them, the way that science and evidence design them to be. So working as the manufacturer. So the big thing is read the label, not just the manufacturer's label, but also the safety data sheet, and then develop a plan, and then determine what needs to be cleaned, and then determine how those areas that need to be cleaned, how they get to be cleaned and disinfected. But we're seeing validation techniques for cleaning and this exponential growth. And this is what really excites me, Jeff, is that we now, as an industry, we can validate what we do. We're implementing what we told people we're going to do. We're going to decrease the risk of you getting infected by an infectious disease agent like a bacteria or a virus, we're going to be part of the community to contribute to a safe indoor environment. And we're going to maintain and revise our plans as we learn more. And that comes through more training. So what I see ultimately, really at the top of the pyramid right now, is a very formal curriculum for professional development for cleaning staff, companies, and even manufacturers. Very holistic approach to a professional development program on using science, using evidence-based techniques on what works, how it works, and being really, our good citizens when it comes to contributing to our communities in making indoor spaces safer.
Well, Gavin, if we do this in another year, 1 year from now, maybe you can say, this is what we did. Everything you just said there, maybe it'll all come true during 2021.
That's definitely the vision at ISSA, Jeff. It's definitely the vision of the Global Biosecurity Advisory Council, the GBAC team. We are working on it. It's going to take a community, a village to do this. But I think if we set our goals high and our expectations high, I'm pretty sure we'll get pretty close to meeting them.
All right. Thank you, Gavin.
Thanks, Jeff. Have a good day.